basically try to see if adding some proteomic markers to what we usually do for lumbar puncture, so the marker we usually measure in lumbar puncture, if adding some proteomic markers that are related with inflammation mainly, so cytokines, chemokines, and growth factors, is able to segregate neurological diagnosis against each other. So to do that, we first dosed about 60 markers in the CSF of 800 patients. A bit less have been kept in the final analysis, around 750. And among these patients, ranging from multiple sclerosis to Alzheimer's disease, encompassing many other diagnostic like migraine patients, it's basically all the spectrum of patients that have received a lumbar puncture. We are able to show that we have immune signature that are different from one group to another, yet it's still a bit difficult to predict the diagnosis itself in a huge organized manner if we use, for instance, machine learning tools, but yet we're still able to differ between diagnoses that are close, that can look like clinically the same, because in clinics we do not want to separate, I don't know, Alzheimer's disease from multiple sclerosis. It's usually not the question we have. But if we want to separate, for instance, multiple sclerosis from neurosarcoidosis that can present alike, here we have the impression that this panel can be of help, and we have shown that it adds something to what is existing with the usual markers, and it can go towards a bit more personalized medicine, and it can help the diagnosis. So we're still working on that with many options to offer visualization to the clinician and also to provide edited report. And last thing we'd like to work also on is to try to define if the patient is an outlier, knowing, for instance, I know this is a relapsing remitting patient, at least it's my final diagnosis, but still I am unsure, is the machine learning system or is the prediction of this multiomic measurements tell us is it multiple sclerosis or not? And we would have a warning and a red flag for some diagnosis to say, okay, to the clinician, you should go a bit further because it seems that your patient is an outlier.